to bring in Dr. Lauren Hughes. She's a professor of family medicine at the University of Colorado. Dr. Hughes, welcome. So the FDA authorized Pfizer and Moderna booster shots for all adults. What else needs to happen before anyone who wants a booster can go get one?
Well, I have to say, as a primary care clinician heading into the weekend, I am incredibly relieved by this news because it will make my job so much easier with the clarity of guidance around this. But I strongly encourage anyone that has questions about the COVID vaccine to reach out to their primary care clinician to get those questions answered.
So, Dr. Hughes, the question I hear so often is about mixing and matching boosters in your primary vaccinations. What's the consensus? Does it offer more protection to try and get a different shot?
That's a great question. I get that question quite a bit in my practice. And I think what's important is to get the booster. And we are seeing that it is safe to mix and match. Certainly, certain patients will prefer to get the same vaccine. But the important thing is that you are boosting the immune system. And so any of the vaccines can do this. And so mixing and matching will achieve that objective of reinvigorating the immune system to combat the virus.
So the important thing is to boost. It doesn't matter as much which particular brand you have. Dr. Hughes, also, according to the Biden administration, new infections rose by 14% between November 8th and November 15th. We had seen it leveling off. We had heard some optimistic ideas about what this fall and winter would look like. So what is driving these increases now? And are there new variants that health officials are tracking and concerned about?
Another great question, Lana. And I think here in the U.S., we certainly are seeing case numbers rise, particularly in the Midwest and in the Northeast. And here in the Mountain West, where I am based, we're seeing the highest number of cases and hospitalization rates at any point in the pandemic. And there are multiple factors that are contributing to this. I think the first one is human nature. Understandably, after almost 2 years of this pandemic, we are exhausted and excited to return to pre-pandemic activities. We're also heading into winter months where for most of us, it'll be a little bit too chilly to gather outside safely. And we're heading indoors, especially as we head into the holidays. And gathering indoors increases the opportunity for that infection to spread. And last but not least, there are still 47 million Americans that have not yet started the vaccination series. And that is a large contributor to the reason that we're seeing some of the increased case numbers across the country.
And how much are variants fueling that? Are you concerned about particular variants, or it's still really Delta that has you all the most concerned in the medical community?
At present, the Delta variant still has quite a stronghold and in terms of the present variant. But we are starting to see new variants emerge in Europe, which is also likely fueling the increased number of cases there. Mutations in the spike protein that is on the outside of the coronavirus that is contributing to those cases there. And we can see that, though we expect mutations to occur, the virus naturally replicates, and the more it replicates, the more opportunities there are for mutations to occur that may have impacts on human health and well-being. The greatest way to reduce the risk of variants and mutations in the virus that can take hold is to increase our vaccination rates.
Yeah. Well, I'm glad you mentioned Europe, because Austria is entering a full lockdown as COVID cases are surging there. Neighboring Germany is warning that it might follow suit. What's happening in these countries? Is there a chance that the U.S. is heading in the same direction?
That's another great question. We're seeing from and hearing from European officials that there are concerns about these cases rising, in part because of the high degree of variability in vaccination rates across European nations. They've also seen a lessening of public health restrictions that, again, could promote the spreading of this infection. And as I just mentioned as well, the increase in variants that we're starting to see coming through. And so again, if we have pockets of unvaccinated communities and portions of states here in the U.S., this may be something that we see coming our way as well.
Obviously, Thanksgiving's coming up next week. So what is your best advice for how Americans can prevent their holiday gatherings from also spreading the virus?
Well, first of all, happy Thanksgiving to you and your family,
And to
Lana.
you.
And the guidance that public health and medical officials have been providing over and issuing over the past number of months still hold true in keeping you and your family safe this holiday season. So please wash your hands, wear a mask, particularly if you're going to be indoors around a company of mixed vaccination status, those that are and aren't vaccinated. Please get vaccinated and boosted if you have not yet done so, considering getting tested before you gather with your family. And last but not least, if you're not feeling well, give serious consideration to whether you need to stay home and not travel to reduce the risk of infection. And if you have any questions, again, a great resource is to reach out to your primary care clinician and practice to get those questions answered.
All right. Dr. Lauren Hughes, thank you so much for answering our questions, and thank you for all that you do.
You're welcome. Thank you.